Okay. Good morning, George.
Good morning.
How are we doing this morning?
Good. How are you?
I'm doing well. Tell me about your week.
It was a good week. The 3-day weekend was nice. Had a good 4th of July. I went to a party and saw fireworks.
Have you seen your children recently?
Yeah. We all went to the party together, so that was fun to spend the 4th of July with them.
That's good. How did work go this past week?
Good.
Okay. So, stress levels this past week, how have they been?
They're pretty good. Nothing really happened at work to put me over the edge or anything, so it was a good week overall.
So do you think they're plateauing, or have you seen an increase or decrease?
I think it's just kind of steady right now.
Steady.
hmm
Okay. And how have things been going at home?
Good.
Good.
hmm
Okay. Um, how have you been communicating at home and at work the last week?
Fairly well. My wife have gotten a lot of time together, so we've talked quite a bit, and work has gone well. I feel like we've communicated with all my coworkers well. So.
Good. Okay, so last week we focused on goal setting.
Mm-hmm.
So we talked about some goals you've had at different points in your life, and then we kind of talked about some goals that you'd like to see accomplished by the end of the treatment journey.
Mm-hmm.
So how did you feel while you were setting those goals?
I felt like they would help me in the long run, giving me like a motive to work towards them.
So you felt comfortable during the process?
Yes.
Okay. And since our last session last week, have you had any time to reflect on some of the goals that you set?
A little. Just kind of thinking about how I'm going to go about doing them.
Okay. Tell me more about that.
Um,
Okay. So some of the goals we kind of talked about last week. We're learning some more coping techniques to deal with your high stress levels, and then communicating better. Talking about feelings more at home and at work.
Mm-hmm.
Do those still fit your mindset right now? Yeah. Okay. Have you thought of any new ones? Or are those two the ones you'd like to focus on?
I think just focus on those two.
Okay. And just making sure it's okay if I write some notes here today.
Yep.
Okay. So today we're going to be making a treatment plan for you to follow to give us kind of a guide as to what we're going to work on throughout the remainder of our sessions.
Okay.
Does that sound okay? Okay. So first, we're going to kind of work with the goals we set last time. So we're going to identify the two main problems that you have.
Okay.
And then from there, we'll have some goals, probably the ones that we selected last week.
Okay.
Then we'll identify some objectives, so how you're going to reach those goals and what objective measures we're going to be looking at. And then I'm going to list an intervention for those objectives, and what those are is just who's going to be responsible for identifying if you've met those objectives.
Okay.
And by what time period.
Okay.
Okay. Do you have any questions for me before we begin?
No.
Okay. And does this process are you comfortable with
Yes.
it? Okay. All right. So first, our problem list. So from what we've been talking about in the first couple sessions, would be impulse control issue. So when you're faced with stress, you have a hard time making the right choices and right decisions. Okay. So that will be our problem number 1. Okay. Would you say that's accurate?
Yes.
Okay. And then problem 2 is that you're having a hard time communicating at home and at work.
Yes.
Okay. All right. Okay. So impulse control. So, what are some examples of some examples of how you think you've demonstrated poor impulse control?
Well, with the workplace incident. That was probably like my weakest time I've ever done it.
Okay.
Yeah, I mean, every once in a while I come home and have a beer after a long day. That kind of impulse makes me feel better, but really in the long run, not really. I would say that's really about it.
Okay. And okay, those are good. So what I'm hearing is that because of the workplace incident and then your need for alcohol after a long day would be examples of demonstrating poor impulse control. Is that right? Okay. So your second problem is that you've been having issues communicating at home and at work.
Yes.
So what are some examples? Has your wife maybe told you that?
Yeah, she's sometimes talked about how or don't talk enough and tell each other things enough.
Okay. How about have your children said that? Maybe some coworkers.
Children, not so much. Coworkers sometimes have a hard time communicating with me. I mean, I'm just not as clear as I should be at times.
Okay. So for your second problem, we have that you have issues communicating. This is evidenced by your wife telling you, and your coworkers saying that you've not been as clear in your instructions. Is that accurate? Okay. All right. So that's the problem list that we'll kind of work from.
Okay.
And now we'll work on some goals. So for the inability to practice impulse control, what would your goal be? Would you say to learn more coping techniques? Okay, so that will kind of go along with what we talked about last time.
Okay.
Coping techniques to deal with those times of stress so that you don't lose control of your impulses and are able to make better decisions. Would that be a good goal?
Yes.
Okay. Okay. So communicating better is the second problem. So what would you say would be a good goal for you?
Maybe just like set, like with me and my wife, set a time aside to talk about if we have any problems or just talk about things.
Okay. So you really want to work on learning how to practice effective communication. Okay. Well, those will be our goals. Okay. So what we're going to do now is to set some objective measures. So for coping techniques, that's your goal for learning for impulse control. So now we're going to make some objectives. So I'm going to give you an example.
Okay.
And then from there you can kind of form what you think would be a reasonable objective. Okay. So I would say learning at least 5 coping strategies to learn, and then share them with me, and then practicing them.
Okay.
So tell me your thoughts.
I think one of the coping techniques I could do is
so does making a list of
yes.
Do you think that would?
Yes.
Okay. And then so another objective would be sharing what you've kind of already done, your past attempts to practice impulse control, and then why those didn't work out the way you planned, and what led you to more undesirable behaviors. Okay. So how do you feel about those? How do you feel about the objectives we've just set?
I think those will work.
Okay. Was there anything you wanted to add?
I don't think so.
Okay. All right. So the second problem was communication. Okay, so our goal was to learn how to practice effective communication. So, what would a good objective be?